quality is the word that's we live, each and every day. I think one, you have to have clinical leadership that's invested and has a good understanding, a good fund of knowledge. They're the content experts of what quality medical care looks like. We can all talk about medical care, but quality medical care, is care that meets the standards that are often set not just by our education and training, but our national organizations and societies. Getting back to cardiology, there are national expectations for the cardiovascular service line. I also think that, outside of the physicians, a CMO is responsible, for an organizational structure that creates and helps develop the culture that patient safety, quality care is at the forefront of all that we do. We often know that no mission, no margin, no mission, we get all that. But what we need is to have an organization where front and center each and every day, quality and safety, it starts there. And again, any quality initiative has to be driven by data. So we set the culture and we align both our clinical as well as our business goals together. And then we ensure that everyone at the table is partnered with us in such a way that they understand quality and safety is the prime directive that we're all given in the healthcare industry. I think there's probably certain industries that are out there that have that expectation. I can think of the Federal Aviation Administration, quality and safety. Yes, we want to get people to their destination, but if we don't do it in a safe and effective way, the destination's never reached. And again, for quality, part of getting that idea of safety and quality is also making sure that it's very patient-centered. And I think that if you give that charge to the members of your organization, where you have good clinical leadership, you foster a culture like a high reliability organization does, and use data, that's going to drive quality and safety.